Hello and welcome to the Functionally Enlightened Podcast with Dr. Sharon Sarita. We interview well-respected medical and functional practitioners, as well as patients who have overcome disabling chronic conditions, such as dysautonomia, and reclaimed their health. These enlightened guests provide helpful tips on managing chronic pain and illnesses, using a combination of traditional and whole-body healing modalities. If you're interested in natural healing and quality of life improvement, you're in the right place. Thank you for listening to today's episode.
Hello, everyone. Welcome to the Functionally Enlightened Podcast. Today, we have our very special guest, Nicole Dube, who is a powerhouse in holistic health and nutrition. She's driven by her personal journey through chronic health challenges of her own. After more than 2 decades in high-stress governmental roles, Nicole faced her own battles with autoimmune diseases, Mast Cell Activation Syndrome, which is very big in our community, and I'm so excited to have you here. We'll definitely dive into that. And then specifically POTS and all of those that fall under the dysautonomia umbrella. These experiences ignited a deep passion for nutrition and wellness, leading her to pivot her career and pursue graduate studies in human nutrition at the University of Bridgeport. Now, as a state-certified dietitian nutritionist, board-certified nutrition specialist, holistic nutritionist, and functional diagnostic nutrition practitioner, Nicole has spent the past 11 plus years transforming lives in private practice. She specializes in helping clients overcome MCAS, again, the acronym for Mast Cell Activation Syndrome, histamine intolerance, and autoimmune conditions by uncovering the root causes of their symptoms. So today, again, we're going to discuss all of this, and our audience is super excited. They've been looking for specialists such as you, so thank you so much for joining us today.
Thanks, Sharon. I'm really excited to be here, and it's great to see you, and Happy New Year, everyone.
Happy New Year, yes. Can you start us off by telling us, I did briefly mention it in your introduction, but what exactly led you to this line of work, and especially how did you transition from conventional space looking for your own treatment and then into what you're doing now?
Yeah, it's a long story, but I'll try to give you a shortened version of it. But like a lot of practitioners, I got into this kind of work due to my own health issues, as Sharon mentioned. And it really started back in my 20s, where I really hadn't been interested in health and holistic healing and any of that before. I was living a pretty standard American lifestyle, eating a standard American diet. But I was working really high stress jobs and working, nights and weekends and 80-hour weeks. And I started to have some health issues in my late 20s. I was diagnosed with celiac disease, Hashimoto's, a leaky gut, all of that kind of thing. And I really had to change my lifestyle and how I was approaching things. And so I started working with a nutritionist myself, who really became a mentor to me. And she encouraged me to go back to school. She's like, you know what, you're really passionate about this. I think you'd be great at this. You should consider it. And so I did. I went back to school and got my graduate degree in nutrition, as you mentioned, and started my own private practice. But really the pivotal moment for me came later in my 30s, when I had the onset of a really severe case of MCAS and POTS. And so I had gotten a vaccination, and I had the first anaphylactic reaction that I'd ever had in my life. And then after that, over the coming months, it just caused this cascade of, breakdown in my body. And it started with my heart. So I started to have cardiac symptoms, and I couldn't exercise anymore, and I would fail the stress tests they would give me. And they did all this testing and found that I had a degree of ischemia in my heart, but they couldn't tell me why. And so they put me on beta blockers, which I reacted to horrendously because it doesn't work a lot of times for people with mast cell issues. But then I also started to have reactions to everything. Anything that I ingested, anything I drank, I ate, any supplements I've been taking for years. And I just would have these extreme allergic reactions to sometimes anaphylaxis, sometimes anaphylactoid reactions. And I would end up in the ER. I probably went to the ER, I'm not exaggerating, like 25 times in the span of like a couple of months. And I was always there. And they couldn't figure it out. And so what often happens is they just dismiss you and tell you have stress and anxiety, and they send you home with no real resolution. But one time I was there, they gave me some iodine contrast dye to do a procedure, and I had an anaphylactic reaction in front of them. So they saw the whole thing happen and the duct lips. And so then they thought, oh, okay, well, we're going to admit you and see what's going on here. At the same time, I had the onset of POTS. And so anytime I would stand up or try to walk around, I would faint. So the blood would pool in my legs and my heart rate would jack up. And if you ever want to lose your freedom in a hospital, faint, because they will never let you do anything on your own again. So I was in the hospital for about a month. I was on a bed alarm. I had to be on my back most of the time. And I was down to 4 foods I could only eat without having anaphylactic reactions. I was on constant IV steroids, Benadryl. And they still couldn't figure it out. I got the $1 million workup and they had these different theories they tested out. They thought I had lupus. They thought I had MS. They thought I had a pheocytochroma on my adrenal gland, which means it secretes hormones that affects sort of your allergic reactions. And none of those things actually were proven true. And so they just couldn't figure it out. So they just discharged me from the hospital with no plan. They diagnosed me with anxiety when they discharged me, which made me want to punch them in the face because that wasn't what it was. And so and I remember it was the day before Christmas. They just sent me home. And I went to my parents' house because I couldn't function. And I spent Christmas with them and I kept fainting everywhere. And so they would find me in the house, passed out somewhere. And it got to the point a day or two later where they just thought, you know what, this is ridiculous. We need to get answers to this. So they actually drove me a couple of hours up to Boston, where there are a lot of great hospitals there. And I ended up at Brigham and Women's Hospital, which happened to have a mast cell center there. So I ended up being hospitalized there for a little bit. And ultimately I got diagnosed with MCAS and POTS. And at first I thought this is fantastic because I have a diagnosis and now everything's going to turn around. I'm going to get a med and it's going to be great. And then I'm going to be back to normal in a couple of months. It was not at all that. It was the exact opposite of that. They gave me some meds and basically told me to go on disability and learn to live with it. And I just remember that moment of just every cell in my body rejected that statement. I mean, I knew that wasn't my path. I knew I wasn't meant to just be sitting in the corner drooling for the rest of my life and so I thought, okay, I realized very quickly on that I had to be my own health detective. I had to be my own advocate. I had to be my own practitioner because I wasn't going to get it from the traditional medical community, because of how it's designed, and it's not their fault. And I've had amazing physicians along the way. It's not to say that that's not the case. It's just that the way the system's set up, it's symptom management, it's siloed. So nobody looks at you as a whole to see how things are interconnected. And so I started my own health journey on my own. And this was back probably like maybe 11, 12 years ago when people really weren't talking about MCAS at all. And there really weren't. I searched high and low for practitioners, somebody to help me, like, I'll do whatever you say. I couldn't really find anybody. And then eventually I found a woman named Yasmina Kellenstam, who is known as the low, her. Yeah. Mm-hmm. She was known as the low histamine chef in the MCAS community. And she really was a trailblazer and a pioneer in that space. And I got I was fortunate to be able to work with her for a little bit. And she really helped orient me to this condition and what was going on. And I really liked her approach and how she was very research-based, and she was constantly, surveying the literature to see what people were finding. And so I started to climb my way out of it myself through dress, like we talk about in FDN, through diet, through lifestyle changes, through, stress reduction and all of those kind of things. But it was something that I had to mostly figure out on my own, just because there wasn't people doing that work at the time.
Yeah. And going back to the time frame when you were first beginning to develop these symptoms to that point where you pivoted, how many years are we talking?
It's funny you say that because I was thinking about it. And when I got sick in my 20s, when they diagnosed me with celiac and these autoimmune conditions, it never quite matched up with what I was experiencing. I always felt like there was more to the story. I really think that's when the MCAS came on initially. And so that would be like 20 years ago. So, and it wasn't even a condition back then. So, so a long time that I was dealing with those symptoms.
And even in my own diagnoses, it's a similar type of thing. I went to the emergency room so many times. Mine, I guess all of the autonomic dysfunction was triggered after I had a hernia repair surgery. So they immediately diagnosed me with anxiety because it was like post-surgical trauma. And that's what they were trying to treat
Right.
in the conventional space. And I went through all of the specialists, and I still see some of them every now and then just to confirm
Yep.
that I'm on a baseline. But cardiologist, neurologist,
Yep.
even neurosurgeon, because
Yeah. I've
I have
got
a
all of
pituitary
those.
tumor. Yeah. And then the allergist, which was the least helpful. And you would think in a
Yes.
condition like mast cell, that would be where you turn, but it's really not helpful. And actually,
It's not.
you get gaslit if you go that route because it's not going to show up on those traditional like skin patch
Correct.
testing. Yeah.
Correct. It's very tricky just to find practitioners in general, whether they're traditional, allopathic physicians or functional health practitioners who understand it, right? And who can really, I had this similar experience to you of just being so frustrated and being told that it's in my head or that I'm just stressed out or what was also shocking to me, which probably happened to you too, is all of this time, even over the last 12 years, no physician has ever once talked to me about diet, about nutrition, about lifestyle. And I've asked, like, hey, are there certain dietary changes I should be making with this condition? No, it's not related. How can you say that? It's just crazy to me. It's literally about symptom management, and what medication fits your diagnosis.
Right. And with people who have mast cell disorders, they're very hypersensitive usually. So when you're prescribed these pharmaceuticals, you may not tolerate it. And a lot of times they'll tell you to start off slowly, but they don't explain like how slowly.
Right.
Can you talk us through like maybe some of your treatment, how you kind of phased into some pharmaceutical intervention and holistic interventions?
Yeah, and I think it's important to say too, when I was first diagnosed and first sick, I was already in the holistic health space. You didn't have to talk to me about the importance of, natural health and approaches and all of that. But what I found initially is my body didn't tolerate those things. My first thought was, all right, give me the natural mast cell stabilizers and let me figure this out. I couldn't tolerate them. I needed medications in the beginning. So I wanted to say that just to say, like, that might be part of your story for a period of time. That's perfectly okay. Mm-hmm. I started out on the traditional MCAS cocktail of medication. So it's high doses of H1 and H2 blockers. So things like, for me, I actually remember once having an anaphylactic reaction to Claritin, and the doctor telling me it wasn't possible because it was an antihistamine. And I was like, but I just did. Right. And I could be reacting to the excipients in it, like the dyes, the other components of it.
So you're bringing this up too, because that's something that a lot of people aren't aware of.
Yes. So it could be, and that's the thing, right? So if it doesn't work for you, let's say you take one of those medications, it might not be the medication, it might just be the secondary ingredients of it. So sometimes taking a compounded version of, say, Benadryl or Claritin that can be helpful for you in the beginning. But I was on that cocktail. So they had me on really high doses of Benadryl. I was taking, I think, 150 milligrams a day, which is like, I was asleep for most of the first year. And a lot of, Pepsid, the H2 blockers. They had me on cromolyn, ketotifen, just the whole typical cocktail of meds.
Yeah.
And I was on steroids for about a year, straight prednisone. So now I felt horrible. It didn't really help. I was just managing the degrees of the reactions, but I wasn't really healing anything, right? So in the beginning, that's what I tolerated. But there came a point where I knew that I needed to change course for myself. And so I gradually weaned myself off of the medications while simultaneously working on other things. So when I built a little bit of a foundation, I did that. So, and I'm not telling people to stop taking your medications. That's obviously something you need to discuss with your prescribing practitioner and all of that. But I will say, like, in the beginning, I did use medications because that's what worked for me. Mm-hmm. So I can't remember I'm sorry, I blanked.
Going to the medications, like in the conventional world, all the ones you listed, I also took. And then from the cardiologist perspective, the midodrine which, it helped to stabilize the heart rate to a certain extent. But then when horizontal, that was the problem because I became very hypertensive. And so that, along with Florinef and quite a few others, the cromolyn, like you mentioned, that one was very difficult to titrate.
I hated that one. I hated that one so much.
Yeah. And like you, I didn't see any real benefits. Actually, on the contrary, like my severe nausea was perpetual, even with the Pepcid and on down, what is the name brand? Zofran. So that was a routine thing, and none of that really helped. So it wasn't until I found functional diagnostic nutrition and even another dysautonomia specialist by the name of Mary Ruddick. I'm not sure if you know.
Oh, yeah. Mary's great.
Yep. I worked with her for 3 or 4 months directly. And to this day, a lot of the fundamentals from her program I still use because the diet is such a fundamental piece. So I know that you're really big on diet.
It's huge.
Can you tell us a little bit about how you have kind of laid out the foundation for people such as you and I and all the other dysautonomia community?
Sure. I mean, for me, I was down to 4 foods. I lost 90 pounds. And then you're not getting the nutrients you need. And so it starts this side effect, this cascade of other issues that you get. And so I started having thyroid issues. I started having dental issues. I lost almost all of my hair, because I really wasn't getting enough calories and also not enough nutrients, over the course of the first couple of years. So but it's hard. The $1 million question always is, well, yeah, that sounds great, but I'd love to be eating more foods, but I'm so reactive to everything and I'm so sensitive. So what do I do? And so I did a couple of things in the beginning. I kept a food journal. So I tracked everything I ate, and it's a pain in the butt. I hate doing it, but it does give you useful information. So I did it by hand, in an actual physical journal. And I also did it, on MyFitnessPal or one of those apps at the time. And so I would look for clues around symptoms of what things were bothering me and what weren't. But ultimately, what I started to do is I knew that I had 0 fat in my diet. So the 4 foods I was eating at the time were apples, chicken, broccoli, and sweet potatoes. That's it.
You're my twin. That sounds like my diet.
I had 0 fat happening. And so I knew that I needed fat in my diet. We need healthy fats for hormone balance, right? I mean, how can we even, make our stress and sex hormones and regulate our nervous system when we don't have the building blocks to do that? So I know practitioners always say, eat low histamine, and start there. It can be a starting place, but I don't like to stay there. First, because you're not getting enough of what you need. But second, it's not, everybody's so highly individualized on what they tolerate that something might be on a histamine list as being, higher histamine or moderate histamine, but you tolerate it okay. And the nutritional benefits outweigh that. So I try to be balanced about it. But what I started to do was track my nutrients and see what I was deficient in and look for foods that had those nutrients in them when I was reintroducing foods. So for example, if I was low in magnesium, I looked for foods that were rich in magnesium I tried to introduce foods that would give me the most bang for my buck nutritionally. So, obviously I'd love to be eating like chips or something, but instead I'd try to reintroduce dandelion greens or something that had a specific benefit for me. And the way I went about doing it was microdosing. So like you were saying, when you're so sensitive, it's like, you just want to start eating something new, but you can't. You have to go in really tiny, tiny amounts and do it in a systematic way over time and use some type of mast cell stabilizer to help you while you're going through that process, whether it's a med or it's a supplement. But that's what I started to do. I would pick foods that were nutritionally beneficial for me, and I would work on adding them in by microdosing. And it started to snowball. In the beginning, it would take me a long time to introduce the food. But as I got more healing and more nutrients in my body, I could do it quicker and quicker and quicker. So that's typically what I do. And the other thing to keep in mind in working with clients too, we always hyper focus on histamine, but your mast cells release hundreds of different types of chemicals. Histamine is just one of them. And so it may not be the main event for you. It usually is for people, but not always. And sometimes people might have issues with things like oxalates or salicylates or FODMAPs or lectins. And so it can be more nuanced than that. Like, for example, I had a client recently that I was working with who she came to me and she had been eating low histamine, I think, for about several months, maybe up to a year, and she still wasn't getting anywhere with it. And when I looked at what she was eating all higher oxalate foods. And when I looked at her labs, it was showing that she had really high oxalic acid in her body. And she was really having some of those symptoms of oxalate issues, right? So she couldn't just she couldn't break them down. And so when we shifted the focus into, say, a lower oxalate foods instead, gradually over time, she really responded well to that. So it's more nuanced, as you know, like everybody's different in what they tolerate. So, but the goal is always expansion. I'm not a fan of restricting down. I understand why. It's your safe place, and you don't want to feel the terrible symptoms you feel when you try to do more. But I think the goal ultimately should be always to expand out.
And you mentioned the oxalic load. A lot of people have kidney disorders, and
Sure.
they have some certain symptoms like interstitial cystitis for one, and they're not making the correlation with the food. And oxalates is a big one. I talk about it often. I know that some of the symptoms that I face and some of the symptoms that other people in my practice have faced is more of the gastric type, but also the tissue pain and not even muscular pain. So
joint pain, all of it. Yeah.
Talk to our audience a little bit more about what they can expect or what other symptoms manifest with these food intolerances, whether it be oxalates or maybe lectin sensitivity.
Oh, yeah, sure. I mean, that's the thing is we focus on the digestive, right? That's obvious. You can experience things like gas, bloating, abdominal pain, all of those types, diarrhea, constipation. But it can affect any system in the body. So a lot of times people might have neurological symptoms, or they might have brain fog or anxiety, depression. You might have musculoskeletal issues like joint pain, muscle pain, like you were just saying. You could have cardiac symptoms like heart palpitations or maybe a irregular heartbeat. You can have skin issues like the traditional hives, eczema, any kind of rash that happens. You can have sinus issues, like maybe after you eat, all of a sudden you have to blow your nose constantly. Or clear your throat, so it can really affect all systems in the body.
With that, also, and when it comes to testing or trying to determine based on the symptoms that the clients are presenting, what are your go-tos? How do you begin that assessment process?
Sure. So typically I will look at somebody's hormones. So usually I'll run a Dutch panel on somebody to see what's going on with their sex and stress hormones. And I will look at the gut, obviously, because I have yet to meet someone with MCAS who doesn't have some form of leaky gut or gut dysbiosis happening there. So we'll look to see what their healthy gut bacteria are doing. Do you have pathogens hanging around that shouldn't be there? Like H. pylori or Candida or different opportunistic bacteria that are high histamine producers, things like that. And then it depends on the person. So those are the two foundational things that I look at. But I also look at genetics with people. I'll run an organic acid test to look for different types of maybe like fungal issues, mold issues, mycotoxin panels. It really just depends on the person once I get a sense of who they are and what they've been going through, what makes the most sense. So, but I always start with gut and hormones and then branch out from there based on the person.
Okay. And when you're developing protocols to assist these people, and they probably have tried numerous diets, so they might be skeptical, but I know you make it very individualized, and you use their assessments to kind of guide them, but how much in depth do you get with the dietary intervention and with the, I guess the rest of the stress reduction principles that we talk about with FDN?
I mean, here's the thing. I think the first thing you have to do when you have a mast cell condition is calm your mast cells down, right? Like, because even if you identify these other factors, like say a hormone imbalance or a gut infection, if you're in this hyper-regulated state, you really can't do anything about it because you don't tolerate, the protocols. So you really have to start by calming your mast cells down. And there's two ways that I do this with people. One is through nervous system regulation work, and the other is through identifying your triggers and finding your mast cell stabilizer that works for you, whether it's medicine or whether it's a pharmaceutical or a supplement. So I think if you're kind of spinning your wheels and you don't know where to start, I think nervous system regulation work is highly important thing to do. And you know this because I know you've done that work yourself. So what does that mean? It means limbic retraining work, vagal toning work. So there are programs out there like DNRS with Annie Hopper, Primal Trust with Dr. Cat, and the Gupta program. Any of those things I think are really important to start doing right from the beginning, because if you can help when you have MCAS or other chronic types of conditions, your limbic response can get stuck sort of in this on position. And what that means is that you're in a constant stress loop all the time, and you never switch your body into that parasympathetic rest, relax, and heal state. And so when you do these kind of programs and these kind of exercises, it can help you rewire those neural pathways to get your body into a place of safety where it feels safe for you to just exist and be in the world. And that allows you then to go and do deeper healing work. So I think that part of it's key. And also, doing breath work and things, I usually will have people do some breath work when they wake up and before they eat, just to help switch them into that parasympathetic state as much as they can. And then simultaneously finding that mast cell stabilizer for you. And maybe it's a med right now, or maybe if you tolerate supplements, it could be something like that. Something where you can just calm your body down and then start to do the deeper healing work from there.
So would that be your starting point always, like trying to neuroplasticity, all that kind of work? And then when it comes to, people who no longer want to approach conventional space again, they're tired of the pharmaceuticals, and sometimes you develop a fear about it. So that again is triggering that neurological response. So how do you approach them if they need some additional supports for stabilizing?
Well, it depends. Another sort of side effect of what you just said too is sometimes people just don't have access to it, right? Like they don't have a diagnosis, they don't have a mast cell specialist, and you don't need those things to heal necessarily, but sometimes that's part of it too. So I meet them where they're at and what they're willing to do. You always have to meet people where they're at. So if they don't want to go the pharmaceutical route and they don't want to go the traditional medical route, then we'll start working with these functional health strategies. So we'll experiment with some natural mast cell stabilizers to see if any of those work for them. So things like maybe perilla seed or Chinese skullcap or quercetin or whatever makes the most sense for them. But we'll start there and we'll start, and you can't underestimate the power of the fundamentals, just regardless of the traditional medical approach. Sleep, your diet, your environment, making sure you're reducing your toxin load in terms of like, what do you put on your skin, what beauty cleaning products you use, all of that stuff. Those are all things that you can work on yourself apart from the traditional medical route.
Yeah, and sometimes people do appreciate the guidance on that. We all know that sleep's important, and we all know we should be getting to bed earlier, but there's still so much more around that so that we get the deep sleep that we need that's very restorative. So
exactly.
What are some tips that you can offer to people who might be waking up multiple times a night still and maybe aren't aware that they should be shutting down their technologies at certain points?
Yeah, I think it's so important. And obviously there's, histamine's a neurotransmitter in the brain and that can affect your sleep. And a lot of times people, mast cells have their own sort of 24-hour cycle. And sometimes people will experience what they call that histamine dump at like usually around 3 to 4 in the morning. And so sleep can be a real issue for people. But I think having a lot of lifestyle changes are just really about consistency, right? Like it's about small changes that you consistently apply to your life that will compound over time in terms of benefits. So in terms of sleep, it's just things like setting a regular sleep wake schedule. So go to bed the same time every night. Ideally, best sleep is to get to bed by 10, but even if you can't do that, just go to bed at the same time every day, wake up at the same time every day if you can, sleep in a cold, dark room. Make sure some people will use blue light blockers at night when the sun goes down. I do that. I find that to be very helpful with sleep. So if you can afford to do that, get a pair of blue light blockers and wear those. And also don't underestimate the power of light. I think getting some sunlight first thing in the morning when you wake up, getting 10, 15 minutes of natural sunlight on your eyes, even if it's cloudy out, can really help you set that circadian rhythm. Moving your body during the day can also help you to do that. And I know sometimes you're limited in what you can do depending on how sick you are. But things like that can be very helpful. But just having a set routine, I think that you do consistently can be very helpful. And also making sure that you power down at least an hour before you go to sleep. Give your body that signal that it's time for rest. So get off your devices, keep them in another room if you can. Do other things other than be on a screen right before you go to bed. So read a book or take a bath or whatever it is that works for you, I think can be very helpful.
Absolutely. And I know they're developing all these new red lights that you can even clip onto your book or to your nightstand.
Sure.
Yeah. So those kinds of things might be helpful. And so kind of pivoting away, you did mention something about movement, like optimizing movement. And that's something our audience typically, I guess they're very restricted. They're hindered because of multiple surgeries. But not only that, even with just, I'm not gonna say just POTS because POTS is a huge deal, right? It impacts all of the organ systems too. It's not just tachycardia or shortness of breath. It's really a disabling condition in many instances. But so a lot of our audience, again, they're limited in mobility. So they're starting off with very small things. Maybe recumbent bike is helpful because they're secure. But I also recommend often like to seek out a physical therapist that might be knowledgeable in the type of condition. But it's kind of limited or very difficult to find those that are knowledgeable. Do you have any insights as to like if someone is pseudo or partially wheelchair bound, what kinds of things can they be looking at?
Yeah, and it's true. I've had trouble finding physical therapists that are knowledgeable in those types of conditions myself. So I would say to work with where you're at, and meaning like say you're in a wheelchair, maybe you do some like hand weights in your wheelchair or lift up a can of soup or something or whatever that you have available to you to just do movements within your restrictions, right? Because I remember when having really severe POTS and not being able to stand up and go for a walk or what, and so I would just sit on the ground and I would do, like sit-ups or like whatever I could do, like Pilates exercises. I would just do what I could within my limitations. And so I think doing those kind of things or chair yoga, if you can sit in a chair, there are YouTube videos on how to do, basic exercises. So I would just try to focus on what you can do instead of what you can't. And I know it can be very frustrating when you're like, well, you know what, last year I used to be able to run a 5K and now I can't even stand up and walk around. And I think you have to just accept where you're at and do whatever kind of movement fits within your limitations at the time. Like, for example, I remember having POTS and just being like, I'm not going to give into this. So I would have someone drive me to a track and I would just walk each day. Like, I remember the first day I only took maybe like 12 steps, like before I got to, dysregulated. And then I went home. And then the next day I came back and I did it again. And then I kept doing it till soon I walked a quarter of a lap. And then over time it was a half of a lap. And then I got to a full lap, so it's just building upon where you're at, if that makes sense.
And Nicole, I'm so happy that you did bring up the acceptance piece because that's something that I struggled with so much. What are some additional things that people can do to get to that level? Yeah. Or is there any like resources that people can look for to help them get to that stage?
Yeah, it's so hard. And I've been in that spot, you've been in that spot, and you go through so many emotions when you're dealing with these types of conditions because they completely rip you out of your life. And you're constantly thinking about the past of what I used to be able to do and being frustrated and angry about, well, why can't I still do those things? And simultaneously having like the other foot in the future of like, well, when am I going to get these things back? Right. And so all you really have is the present. And you have to reach a point where you can accept where you are in that moment, because that's the only thing you really have. And that's the only place you can start healing from. And it can seem counterintuitive, like you're giving into it, but that's really the place that you have to be at, that place of radical acceptance. You know what? There's a book called Radical Acceptance that helped me quite a bit when I was in that headspace. I think we all get there in our own time. I think finding a therapist can be helpful too. I know for me in the area where I live, there's a therapist who specializes in chronic illness and things like Lyme and mold, and can help people work through those emotions that they have around illness. So that can be very helpful. I think sometimes too, this might sound a little bit odd, but doing things for other people. And what I mean by that is like whatever your, obviously depends on what your limitations are and what stage of healing you're at. But I remember when I was first sick and in a wheelchair, I couldn't leave the house without a wheelchair because of the POTS. And so I remember talking to a good friend of mine and saying, well, I can't still see clients because I had been out of my practice for about a year while I was sick. And I was saying, I can't do that. I'm too sick. I can't do that. And she said to me, well, does your brain still work? And I said, yes. And she said, well, I said, but I'm in a wheelchair. She goes, well, wheel yourself in, wheel yourself in there, meet with somebody, even if it's just for an hour a day, do it. And she was so right, because when I did that, it took me out of my own situation. I was focused on someone else and helping them. And I realized that, I didn't think about what was going on with me for an hour. That's fantastic. So if you can find ways to take yourself out of your situation, and focus on something else. Like if you can do, I don't know, volunteer if that's something that's an option, or go spend time with a friend or a family member who's struggling with something. I think as much as you can take yourself out of your own stuff, that can also be helpful as well.
Yes, I 100% agree. And I think that's why clinicians like yourself get and stay in the space that you're in, because it is an emotional toll. Sometimes we relive our darkest days, and
Sure.
we know we don't want anyone else to experience those, but that also gives you the empathy to really dig down
Yes.
and figure it out. So with that, I wonder, what are some things, I guess two-part question, what are some things that your clients have a really tough time sticking to or remaining compliant, but you know that it's really the piece that might be the shifting point?
Yeah, that's a great question. I think it's not one thing. I would say it's just more of having the endurance and the consistency to apply everything, right? Because it's never one thing that is the magic bullet or the magic cure, right? It's often a bunch of things in combination that propel you forward. So it's diet, it's lifestyle, it's all those things, nervous system regulation. I find that it's just hard for people to be consistent about it because you don't feel well all the time. You're just like, I don't want to do this gargling exercise or whatever I'm trying to do. I don't feel well. So I think what I've found to be the people that are the most successful are the most consistent in what they do. And particularly around nervous system regulation work, I think if you just do it every once in a while, it's not going to have that compound effect as if you do a little bit every day. So I'd rather you spend 10 minutes every day doing something. When ideally we want you to do something for an hour. I'd rather you do it 10 minutes every day than an hour every 3 weeks. You know what I mean? So I think what I find people have the most difficult time with is being consistent about these practices. And so in that case, what we'll do is we'll take a look at everything and see how we can pare it down so that it's manageable for you. And if it's just 5 minutes of doing something, we're just going to do it for 5 minutes every day. And then we'll build on that over time. So I think it's more that than it being any one particular thing that's the most challenging. it's just the combination of things and being consistent.
For sure. So the consistency is the biggest thing.
Yes.
Like you said, if it's 5 minutes that they can dedicate daily, you also feel a sense of accomplishment when you can stick to it. And
yes,
that might be the piece that they need. Just a hope that there's improvement and
exactly
get things done.
And I also think we're under this sort of misconception that everything needs to be big in order for it to work. You have to be taking the maximum amount out of a supplement, or you have to be doing an hour's worth of nervous system regulation every day. You can still get benefit from doing those things in smaller amounts or smaller increments. It's the consistency that's the key. That's what you build upon over time. So
Nicole, I know you offer, online courses. You also have one-on-one availability. Is that correct?
yes, that's correct.
Okay. Can you tell us a little bit about that so people know how to reach out to you or where to look you up?
Sure. So my website is forginghealth.com. And that's also my Instagram and Facebook at Forging Health. So you can find me there. I do one-on-one coaching with people. And I also have an online course. If you're not able to do that and you just want to orient yourself to what's happening with MCAS, I have that as well.
So we will have that in the show notes. And thank you once again, Nicole. It's been a pleasure.
Yeah, thanks so much, Sharon. And just want to say to people, if you're dealing with this, you can absolutely get to a better place. It just takes some time, some work, and finding the right people to guide you. So if you encounter practitioners who don't resonate with you, move on and find somebody else. And you can definitely heal.
Yep, solid advice right there. So thank you. And thank you to all our listeners. We'll see you on the next one. Take care.